Here are some of the warning signs about your menstrual cycle that you should never be ignoring. If you have heavy menstrual bleeding, which is loss of more than 80 ml of menstrual blood, or if you end up soaking pad or your tampons every 1 hour, if you're passing clots as big as a rupee coin, or if you need to use double protection, if your bleeding is extending more than 7 days, or in case if your bleeding is way too infrequent or too frequent less than 21 days, or if the periods are happening more than 3 months, then also it is usually considered to be abnormal. And in case if the bleeding happens in between the periods, which we refer to as intermenstrual bleeding, or if the bleeding happens after the sexual intercourse, which is referred to as postcoital bleeding, or in case if you end up having bleeding once you have attained menopause, which is referred to as postmenopausal bleeding. Also, if you have too much of pain abdomen, which is referred to as dysmenorrhea during your periods, then also it is considered abnormal. If your cycle is associated with unusual discharge or bad odor, this could suggest infection. And also, if you have missed your period and not using any contraception, do remember to consult the doctor and get evaluated for pregnancy as early as possible. If you have any of these above unhealthy period signs, do remember to consult your doctor and get evaluated ASAP.